Hello, hello. Welcome to this lesson where we are going to look at crisis intervention. We have already discussed crisis as a topic. We have discussed the types of crisis and the steps to follow in the management of crisis. We also discussed the signs and symptoms of the patient who is having a crisis. So our interest in this topic is to look at the many interventions that can be done for a patient who is having, or a client who is having a crisis. So we are looking at crisis intervention or management of a crisis. Okay, so in looking at the management of a crisis, we need to appreciate that individuals experiencing crisis have an urgent need for assistance. In crisis intervention, the therapist or other interveners become a part of the individual's life in this situation where they are experiencing a crisis. Because of the individual's emotional state, he or she is unable to solve their problem. So they require guidance and support from another person. In this case, it's us, the counselors or crisis interveners, so that we can help them mobilize the resources that are needed to solve their crisis. Lengthy psychological interpretations are obviously not appropriate for crisis intervention. This is not a time for grammar and use of ambiguous terms to help the patient solve their problem, or else you just make the patient seem to be stupid or silly. It is a time for doing what is needed to help the individual get relief, for calling on the actions that are needed and the resources that are needed for them to come out of their problem. The goal of crisis intervention is the resolution of the immediate crisis that the patient is passing through. Its focus is on the supportive, with the restoration of the individual to his pre-crisis level of functioning, or possibly to a higher level of functioning. The therapist's role is direct, supportive, and that of an active participant. Crisis intervention takes place in both inpatient and outpatient settings. The basic methodology relies heavily on orderly problem solving techniques and structured activities that are focused on change. Through adaptive change, crises are resolved and we can now expect growth to occur in an individual that may be experiencing a crisis. Because of the time limitation of crisis intervention, the individual must experience some degree of relief almost from the first interaction with the therapist. Crisis intervention then is not aimed at major personality change or reconstruction, as may be the case in long-term psychotherapy, but rather crisis intervention is aimed at using a given crisis situation, that is at the very least the crisis the patient that has come with, to restore the patient's function and enhance personal growth. So there are some phases that can be followed in a crisis intervention, and the nurse can play many roles. So the nurse responds to crisis on a daily basis. Each and every time, patients who were busy doing a lot of things in their lives to achieve their goals, they have come with conditions that have affected their programs. So each and every time, nurses have a role to handle crisis that the patients may be having. Crisis can occur on every unit in the general hospital, not just in mental health settings. In the home settings, crisis can also happen. In the community and other healthcare settings, on schools, offices, and private practice, we see patients experiencing, or clients experiencing different types of crisis. Indeed, nurses may be called on to function as crisis helpers in virtually any setting committed to the practice of nursing. That's why we have some counselors at work, okay, who I would recommend that they should be nurses or they should be trained psychosocial counselors to help clients that may have a crisis. Okay, we have people that start, all of a sudden they start drinking a lot of alcohol and they never used to. All of a sudden they stop coming for work and they never used to. So nurses or psychosocial counselors or crisis therapists need to identify such people in these places. Okay, so in this, I'm going to look at Robert and Orton's 7-stage model of crisis intervention. Of course, this is not something very new, or this is not something very far from what nurses necessarily do, because in nursing we have steps, the nursing process steps. So what Robert and Orton necessarily proposes is similar to the nursing process stages. But now these stages that have been proposed for crisis intervention by Roberts and Orton's. So this model is summarized for specific phases in the it has summarized the 4 specific phases in the technique of crisis interventions, and they are clearly comparable to the steps of nursing process, like I have indicated. So the phases are discussed in the following fashion. So we have phase 1, which is the assessment. Okay, then we have phase 2, which is the planning of therapy. Then we have phase 3 for intervention. Then we have phase 4 for evaluation of the crisis. So those are the phases that Robert and Orton proposes in the management of a crisis. So you can see that there is a similarity with the nursing process. So phase 1, assessment. In this phase, the crisis helper is going to gather information regarding precipitating stressors and the resulting crisis that prompted the individual to seek professional help. A nurse in crisis intervention might perform some of the following assessment. Okay, so the nurse will ask the patient or client to describe the event that precipitated the crisis. The nurse will determine when it occurred and will assess the client's physical and mental state, okay, to do with coping and stability. The nurse will also determine if the client has experienced this stress before, and if so, which methods necessarily did the client use to solve their problem. Okay, so if previous coping methods were tried, then what were the results? Did it help that much, or did it worsen the problem? If new coping methods were also tried, then what were the results? When habitual methods of problem solving fail, clients tend to do some trial and error of new problem solving skills, and then afterwards, then they seek advice from people, friends, and the likes. So the nurse can also assess suicide or homicide potential and plan for this to avoid the patient committing suicide. So you need to have a suicide kind of agreement with the patient, so that the patient will not commit suicide, but wait for the support that you can necessarily give until they come out of the situation. You can determine the level of pre-crisis functioning of the patient and also the adequacy of support system, okay, as a nurse, and also as a nurse or psychosocial counselor. You can also assess usual coping methods, available support system, and also the ability of the clients to solve their problem. This can be determined from the patient's resources like income, how much they are earning, and the amount of problem that they have. Sometimes problem might not be financial, but necessarily here we're trying to use it as an example if at all what they're having is a financial problem. So you need to see at their capacity to solve their problem. So the nurse can also assess the individual's perception of personal strength and limitation in a view over the problem that they are facing. So you can assess the client's use of substances. Information from a comprehensive assessment that you have taken can be analyzed, and appropriate nursing diagnosis will be arrived at. Okay, this will reflect the immediate crisis situation that you have necessarily identified. So some diagnosis may be relevant, and it may include some of the following. Okay, so ineffective coping as one of the problems that the patient with the crisis may have. They cannot maintain homeostasis. They are not able to cope with their crisis. So they have some disequilibrium. Okay, then the other problem that may face is that of anxiety. Okay, this is because the patient is in severe panic to solve their situation and get back to normal life. Then the other problem that they may face here within the assessment that we can establish is that of risk of self. Okay, that is risk of injury to self or others. Okay, so there can be directed violence of the patient to self or others. Then for those that might have faced, let's say, a rape case or so, something like that, they may be traumatized after this situation. They may experience what we call rape trauma syndrome. But any other ordinary crisis, patient may face post-trauma syndrome. Okay, post-trauma syndrome after the trauma that brought about the crisis. Then patient also may have fear as part of the diagnosis that we can establish that the patient necessarily may have. Okay, so with phase 1 discussed according to Robert and Orton's interventions, let us now look at phase 2. Okay, and in phase 2 we are going to look at planning of therapy, or planning of the therapy that's supposed to be offered. In the planning phase of the nursing process, we as nurses, we are going to select the appropriate nursing action for the identified nursing diagnosis. In planning the intervention, the type of crisis as well as the client's strength that is available and the resources or the support that is there is going to be taken into consideration. Goals are established for crisis resolution, and the return to increase in the pre-crisis level of functioning is going to be achieved. So we have to plan the therapy of our clients. Then phase 3, intervention. Okay, so during phase 3, the actions that were identified in phase 2 are implemented. The following interventions are the focus of nursing in the crisis intervention. So the nurse will use a reality-oriented approach. The focus of the problem is here and now, so the nurse needs necessarily to help. We are supposed to remain with our client who is experiencing this panic anxiety because of risk of suicide and the risk of violence to self or others. Then we are also going to establish a rapid working relationship by showing unconditional acceptance, by active listening and also attending to the immediate needs. Okay, then we also set firm limits on aggressive, destructive, and behaviors. Okay, that is where patient is showing high level of anxiety. So this behavior is likely going to lead to impulsivity and regression. So we have to control this. We also try to establish the outset on what is acceptable and what is not, and also maintain consistency in trying to give the proper therapy to our patient. We will also try to clarify the problem that our client is facing. As nurses or psychosocial counselors, we need to do this by describing the perception of the problem that the patient is having and compare it with individuals that may have faced the same problem before. We will help the client to determine what he or she believes precipitated the attack or the crisis, and then we will acknowledge the feelings of anger, guilt, and helplessness or powerlessness that the client may be facing. Hence, by this acknowledgement, we are now going to provide positive feedback for the feelings of the patient, so that the necessary empathy and sympathy that the patient needs in this situation is given to the clients. Then we can also guide our clients through a problem-solving process by which we may move the direction of positive life change. Okay, so this can be achieved here by confronting the source of the problem that is creating the crisis response. We can encourage our client to discuss the changes, okay, that he should like to make. That is jointly determine whether or not the desired changes are realistic. You can encourage exploration of feelings about aspects that cannot be changed, okay, and explore alternative ways of coping more adaptively in these situations. We will discuss alternative strategies for creating changes that are realistically possible in this situation, and also weigh benefits and the consequences of each alternative. We can also assist our clients select alternative coping strategies that will help alleviate future crisis situations. Okay, so in handling this situation here, we can also identify external support systems like organizations that can come to the aid of the patient and introduce them to social networks, okay, that can help in their situation. Then phase 4. Phase 4 is evaluation of crisis. Evaluation of crisis resolution and anticipatory planning. So in this phase, we are going to evaluate the outcome of a crisis intervention. Okay, we are going to have a reassessment to determine if the stated objectives have been achieved. That is, has positive behavior change been achieved in our clients? Or has our client developed more adaptive coping strategies? Or has our client grown from the experience that they have gained during the therapy session? Or does the client believe that he should respond with healthy adaptation to future stressful situations and prevent crisis that of the same kind that they might be facing? Okay, so we can also look at it that the client necessarily plan an action for dealing with stressors that are similar to that precipitated this attack. During the evaluation period, we, the counselors, crisis interveners, okay, we are supposed to help the client summarize what occupied them or what occupies the interventions that they need necessarily to implement. We have to review with the client what they have learned and anticipate how they will respond in future to problems that they may be facing. We can also determine regarding a follow-up therapy if needed, and we can also determine if follow-up therapy is needed and provide referral information on how best the clients can be helped. So in looking at crisis intervention and also crisis, okay, as a topic, it is important that all individuals know that crisis at one time or the other, they may face them as part of life, but how they come out of it is what necessarily make them mentally healthy. So this does not necessarily mean that when you are facing these crises and then you fail to solve them, that you have a mental pathology. No. Okay, each and every individual sometimes faces these challenges and they may need help to solve their problem. So crises are precipitated necessarily by specific identifiable events and are determined by an individual's personal perception of the situation. They can be acute rather than chronic and generally will last not more than weeks to a few months. It is therefore important as crisis interveners or counselors that we understand a crisis, okay, and also the many interventions that we can give to the patient so that they are not affected by crisis in future, but know how they can draw up some action plan. So we have been looking at crisis intervention, and the theory or model that has been very helpful here is the 7-stage model that was put forward by Roberts and Ortens. Okay, so this model is very, very similar to the nursing process. So when you're looking at how you are going to intervene in the client who is having a crisis, you have to think about this 7-stage model that was proposed by Robert and Ortens. Okay, that starts with assessments and the likes, like more like the nursing care plan. It starts with assessment, then from assessment, after you have done the appropriate assessment, you arrive, of course, at the diagnosis. But according to Robert and Ortens, from phase 1, where there is assessment, then you move to phase 2, where you do planning of therapy. From planning of therapy, phase 3, you do some intervention. From phase 3 of doing intervention, you move on to phase 4. So in phase 4, according to Ortens and Robert, it's a stage of evaluation. Okay, so it's a stage of evaluation. So you do the necessary evaluation as to whether the patient has gotten the concept on how to deal with their crisis. So here we are calling it the 7-stage model of crisis intervention, but we necessarily talk of phase 1, 2, 3, and 4 in this. And what is important is knowing what is happening in the assessment stage, what is happening in the evaluation stage, and other stages that we have discussed. So from me, I'm saying thank you, and please keep studying.